Hello and welcome to yet another exciting episode of the Pharma Marketing Playbook, Data, Gen AI, and Beyond. Your go to podcast for mastering pharmaceutical marketing, data analytics, and AI trends. Join industry leaders as we explore cutting edge strategies, the role of AI, and how data driven insights are revolutionizing the pharma landscape. Tune in for actionable insights to stay ahead in the fast evolving world of pharma. I'm very excited today to have a very special guest, Ms. Jyoti Patil Shah, with us. Jyoti Patil Shah is a dedicated leader in the healthcare ecosystem with a strong background in psychology and counseling. She holds a bachelor's degree in psychology and master's degrees in industrial psychology and counseling psychology, along with a diploma in medical transcription. She has also worked extensively with marginalized children and families and served as visiting faculty at SNDT University, mentoring postgraduate students. Since 2008, she has been We Care Foundation, a not for profit organization supporting cancer patients with care and compassion. Ms. Jyoti has held various leadership roles, including program manager, before becoming the chief executive officer of the organization. WeCare has supported over 11 lakh patients in the last 5 years and expanded its presence across India and Nepal, partnering with Tata Memorial Centers and many other hospitals. We are truly honored to have you today with us, Ms. Jyoti. Welcome to the show.
Thank you, Soumya, so much for this. Looking forward, yeah.
You have such an illustrious career. Would you like to start by sharing your career path? How did you lead up to your current role as the CEO of VK Foundation? What was your motivation to join in this particular industry and take up this path of work? And what motivated you to transition from counseling to patient advocacy in cancer care specifically?
Yeah. So when I started with WeCare, it was in 2008. So as you mentioned, I started as a program manager with WeCare, and before that I was working with different schools with children from difficult families and broken homes, everything. But I think it was just that the organization was starting a new program, a patient access program, and they were looking out for a program manager. And I think I was just not, it was not something that I was looking for, but a friend of mine just said, they're looking for something, and would you like to try something new? And I had taken a break of like 6 months from the schools, and I was just like trying to enjoy that little sabbatical and then come back, to work. So this came up, and I was like, okay, fine, let me see how it is and what. And I still remember the very first day when I was walking towards the office, because our office is near Tata Memorial Hospital Parade. And walking that lane for the first time in my life, coming for an interview at the office. So I mean, I saw the entire, I mean, everybody is quite overwhelmed when they walk that lane because patients are all around, they are there on the road. And I was like, what am I hope I will be able to do anything justice to the job that I'll be taking in. But when I came, and it was just the thing of trying something new to do, and something out of the box. I think as people who are working, or as career streams, we look for something challenging, we look for something different than what our regular work is. And that's what I think motivated me to take up this opportunity. But I'm glad that I took up that opportunity, and it's like 18, 19 years down the line, and I've learned so much. And it's like everything learning on the job, whether it is doing your presentations, whether it is photography, whether it is making content for social media, creatives, whatever it was, everything was learning on the job. And fortunately for me, it was Vandana ji who started the organization, believed in the work that I was doing. And she knew that I think her trust in me was because she wanted to like now take a step back, and plan for a succession. How do we go ahead with because naturally it's a founders organization. And then she being the founder of the organization, she thought now it is for her to take things slowly, and then see, hand over the reins, and see, give the baton over, and see how the organization goes. But I'm glad that because since 2000, I mean, we all know that COVID came in, and things were difficult. But fortunately for us, it was quite exciting, because at that time we extended our work to Varanasi, to other hospitals outside of Bombay. So COVID was the time when we started working outside of Bombay. So I think that was one step ahead that we took, and it's been growing, and I mean, that's encouraging, and that's quite fruitful. Yeah.
Very true. And actually, WeCare has been supporting cancer patients for almost 3 decades now.
Yes.
And you yourself have been there for over 15, 16 years with the organization. So the organization's mission, though, was to always, be at the forefront of cancer care. But this also has certain milestones when we look back. And in terms of that, when you look into your journey, what were some of the milestones that, as a leader, you saw them very important for the growth, and then you work towards them to achieve those milestones?
Yeah. So as an organization, when it started, it was the core was basically emotional support. Because that's what Vandana ji felt when she went through her cancer journey. She felt the challenges because, as a literate person, she found it difficult to understand what the diagnosis of cancer was when the doctor handed out to her. And then she felt that, people coming from rural are having the same challenges. How do they understand all this? And that's how the birth of WeCare, I would say, happened, because just to ease the journey of cancer patients within the hospital logistics. But I think as the organization grew, there were different things that we kept on adding on to the patient care programs, because the doctors came back with feedback, the patients came back with feedback. So there were different things, like either whether it was infection control kits that were given to pediatric patients, because these were kits given to admitted new patients at the Tata Memorial Center, so that the infection can be controlled, and and when during their chemotherapy, so that their chemos go smoothly and there is no interruption. Similarly, I think, as I said again, during COVID, we extended our work to Varanasi hospital. And similarly, gradually, I think in the last 5 years, we have kind of benchmarked in different hospitals, whether it is Mullanpur in Chandigarh, or whether it is Khachar Hospital in Assam, or Kolhapur Cancer Center in Kolhapur. And very recently, we have started in small ways, but at Patan Health Sciences in Kathmandu. So I think this is how what we see, benchmarking ourselves slowly but gradually, wherever we can reach out to ease. And especially, Soumya, I feel the tier 2, tier 3 cities are where the need is so much, because cities like Bombay, we have people supporting, people are very giving in a city like Bombay. But there are other cities where regional centers are there, and then I think the challenge for them is how do they get the support that a city like Bombay gets from for the patients. So I think that is what we are moving towards, and seeing that we try and reach out to these section of patients who really need that support, who come from the very rural part of the states that we cater to.
True. And I think health literacy is also an important aspect, because when it comes to cancer, we need to also possibly take the whole family and the caregiver into perspective, because they are continuously along with the patient going through this journey, which is not,
True.
something which is very easy most of the times. So it's something which is, I think, health literacy, creating that kind of an ecosystem where they feel at ease. Even taking care of the basic facilities becomes so much more important, and so much also heartwarming, because they're already going through a lot, in that sense. So, can you discuss how did you look into participating and building on this? Because I've seen that WeCare has done a lot of work around health literacy. And if you could explain that, how is WeCare looking into health literacy? Because I can understand, as a not-for-profit organization, the budgets would also be very limited. And that's where I think, the concept of this podcast is to look into tech. And
Yeah.
how did you leverage tech, or how do you think tech could be leveraged further to, within the budgets, create such an impact?
So again, health literacy is basically what making the patients and the patient communities understand what their diagnosis is, or how what is the best to empower them to kind of ask the right questions. So when we talk about when we talk about physically kind of navigating them through the journey is when they get the diagnosis, we explain them what all does that mean. When, like, for example, a patient has been told, okay, he's been newly diagnosed, he or she will be told, okay, you need to do a battery of tests. Now the patient is unaware of these battery of tests that has been says. The language is foreign to them, whether it is biopsy, whether it is PET CT, or these are terms that the doctors have told them. But for us as a navigator or as a patient advocate, what we have to make them is simplify this to make them understand what do these tests mean, and exactly what they need to do for, if they have to go, whether they have to go empty stomach, whether they have to drink a lot of water for these tests to be done. Okay, if a biopsy is done, what is the procedure of a biopsy? It's like a semi surgery, where the tumor is taken out, and then, so naturally, the reports will take some time to come. Now, why do the reports take time to come? There is a reason behind it. So all this needs to be explained to the patient, so the patient is not apprehensive, the families are not apprehensive ki, the reports have not yet come, we are just waiting for the reports. So I think all this is somewhere health literacy works, wherein we are kind of informing the patient or educating the patient about what has been the diagnosis meant, or what will come ahead going forward, what does chemotherapy mean, or radiation mean, or surgery mean, and what are the precautions that they need to take when they're undergoing all this. So that has been one of the things. And also similarly, I think somehow, again, because as COVID came, everybody turned to technology, everybody took the medium and used it to the maximum. Similarly, WeCare was no different. So we started our webinars through those mediums. We had the through our social media handles, we had a lot of webinars with doctors, and in very basic Hindi and English, whatever could be the mix of Hindi English language, which I think were things which through YouTube, everything through our Facebook channels, through our Instagram channels, we could reach out to the people who were a part of it. So that was how we started leveraging the digital medium. And naturally, as a digital medium, we all know how much social media plays a part. So naturally, that has been another forte where we are very active on our social media pages, where things are like put out, our survivor stories are put out, so that people know. We had our survivors day event just in February. So those stories need to come out, so that people are comfortable in talking about cancer as such. So that stigma around cancer is, I wouldn't say it will go away totally, but at least we can try and see what we can do better with the platform of the digital medium that we have.
Very true. And I think this also brings, possibility of collaborations with, as you mentioned, healthcare operators, physicians, professionals. Sometimes even, path-breaking research could be explained. If
Yes.
they're looking for, certain patient recruitment programs where people from marginalized families, etc., who
Mm.
could actually benefit from these, and
Mm.
thereby, yeah, it becomes an important medium. So, any other efforts on where you're looking to collaborate with medical institutions, etc., in the future?
So we work totally with hospitals, because, as I say, our main forum has been patient navigation for the hospitals. So yes, I mean, like I was just at a meeting just 2 days back, where they were talking about evidence based advocacy. Where how data will help us to kind of leverage the advocacy efforts in the forum. So I think, when we talk about data, I know there is a challenge within the Indian sector, where there are no cancer registries, are not very huge, or they are not so robust. They are there. I'm not saying it's not there. It's there, but it's not very robust. And I think that is somewhere we all together we need to work and create that data. Now, even as an organization, we have a we do this yearly analysis of the patients we meet. So we kind of dissect them in knowing from what was the need that the patients had. So all that, when we sit back, we can do only because the data is available for us, and we can see from which regions were the patients more, which cancer was the most common cancer that we dealt with, or what was our male female divide when we supported patients. or our children were supported. So all this happens only because of data that we have, and that this is how we leverage with the hospitals when we work with them, wherein we let them know what we can make available for them. So with hospitals, it's never a paid or anything. It's always a pro bono thing from our organization perspective, because we know that we are here to serve patients. And as I said, we are looking out to work with more hospitals, maybe outside of Bombay, and in a way where remotely we can work with the medical social work department or the physicians there. We can collaborate. Similarly, like we have just been like a part of a patient support group. We do a lot of patient support group meetings, not only for patients but for caregivers too. And we have been a part of a few of them where we have initiated these meetings, and because it was not there in the hospital setup. So the hospitals are very happy that there is some organization who is ready to take on that little responsibility, because as you know, doctors are very pressed on their times. Hospital healthcare other workers are also pressed on their times because of their responsibility. And I think as a patient organization, as we care, this is where we can leverage our support for these different hospitals, and that is what we are trying to work around and do.
And I'm just thinking, this is such an important aspect because along with the treatment plan, the chemos, etc., there are also certain other emotional factors. It might be hair loss, or it could be weight loss, or it could be
Yeah.
other psychological impacts of the medication that goes on. And thereby, the patient support programs become so much more relevant and important. How do you think, given that the rate of cancer surge that is prevalent right now within India, how do you see this could scale to a much bigger transformational support program working with the hospitals? What's your vision on that?
So yes, I mean, to the point, because we call them as in-kind services, because these are services where it's not about giving funding for the treatment such, but it's about getting a wig for a patient, or even like a bra and prosthesis for a mastectomy patient, or something that like chemo caps, which is just a cap which is made for them to cover their head. So there are many multiple things to adding to that, is even for like something like a sanitary pads, because everything matters and patients are undergoing what they are undergoing. And when hospitals in Bombay or patients who come to Bombay know about these services, because there are organizations who are catering to these services. But again, as I said, the tier 2 tier 3 city hospitals don't even know that these kind of services exist, where these HEVICs can be given to patients, who they can avail that facility. Or there is a prosthesis that a mastectomy patient can use, which is a cotton prosthesis which is washable. So these are the things I think we kind of reach out to hospitals and say, okay, look, we have this and we are happy to support your patients with this. So if you're we just kind of meet the counselors at the hospital, the medical social work department, so that they know of the services that are there, and that then the patients can leverage that service from the hospital itself. So I think this is how we try and reach out to. And as you said, these are all something emotionally connected. Now, even we have literature, we have information booklets on different cancers, on emotion, on psychosocial topics like hair loss, or even like physical intimacy during cancer. I mean, these are topics which are not even spoken about openly, but there is a need because the patients and the caregivers are looking for discussions around these. And I think it's difficult for the doctors to kind of talk about it, because again, as I said, because of the time. And most of the doctors know that we care exists, and they kind of try and send their patients or let them know, okay, please call this organization or reach out to the organization and they can help you. And that is what we are looking for with different hospitals in near future.
Yeah, I think that's a wonderful thought, and great accomplishments that you're doing. Great service to the patients. So, in what ways, coming back, digital transformation influenced WeCare's operations and outreach efforts? Because you're catering to 11 lakh patients in the past, and the numbers are completely, out of hand today. They're just growing crazy. So, what digital tools or platforms have you been particularly using? What you found effective? And any messages for people who are listening to us from the healthcare industry or from pharma, those who could learn something.
So I think the digital platform, for us it's going to be more so about raising funds, or even as an organization, because I see that when I talk about digital platform, it will be for the medium of people who will understand, and have the access to it again, more so the semi urban or the urban setup. And when I say, okay, awareness, it could be having different awareness programs, maybe catering to the corporates, or maybe catering to different people who understand the medium and have the access to the medium, because we all know that there are challenges with network facilities to remote areas where where our grassroots levels are. There is a network, but still, people in the cities also, we also do have our own technical challenges when it comes to network issues. So thinking of that, when we say we want to do something digital, we look out for people who can access it more easily, and maybe doing these awareness programs or doing the fundraising programs with those kind of audience who will understand, and would like to share our work with them, for them to know how they can support us, and do the best out of it. Yeah.
Today is the world of AI. You hear AI, in literally everything, and I don't think there's any looking back. Going back to an era without AI.
Yeah.
So, as a leadership of WeCare, how do you feel you can leverage AI to better support cancer patients and personalize this care in the future?
Yeah. So I mean, it's a wonderful tool. Okay. At the end of the day, AI is something, I think. But yes, also at the same time, I would say it will never be a, what do you say, a replicate for an human brain. But also my message would be that yes, we should use AI, but we should know that how well we can use that, and how well we can enhance that to better the services that we have. Because I think there's a very thin line where people don't understand how the misuse of it, and also the real use of how to leverage your skills out of it. Coming to how WeCare is looking into it is, yes, totally, again, as a medium, it will help us in maybe going forward in data collection, maybe somewhere down the line, keeping a track of things that we do. But with our human connect, alongside our human connect, not in totally as an AI yet, but also having the human, because other than, we will be nowhere without human touch. So I think that is what one has to understand, that at the end of the day, it is going to be artificial intelligence, but also we need the human intelligence to merge together, so that we have a fruitful outcome out of it, rather than just making it a lot of youngsters I know, just copy things and say, okay, if they want anything, they go to Chat GPT and say, okay, just list out a thing or write a project. But I would say, write a project first and then go to AI with your matter and then assess the thing. Because I think that's where it will also help you keep you mentally active, but also see what as an AI can do for you, and leverage that at the best of your capabilities. Yeah.
True. I mean, there's a joke around healthcare, closed circuits that, a patient consults, earlier it used to consult two doctors. One was a real doctor and other was Dr. Google. And now with the advent of AI, maybe you'll have a Dr. Chat
Yeah.
GPT also. So when it comes to counseling,
Yeah.
does it make
You know,
life of a counselor harder?
I don't know. I mean, you see, basically, when you talk about counseling, or when you talk about all these aspects where cancer care comes in, there needs to be a human touch. There needs to be, because alongside digital platform, there has to be the human face for it too. because that will help. I was in a meeting last year in Chicago. ASCO is one of the biggest platforms where first-hand research is published, and people talk about it at the ASCO meetings, which happens in Chicago in the US. And there was a presentation by a doctor, and I found it quite touching, because he was like, we want AI, but we want AI to do our jobs in terms of maybe laundries, or assist us in all these things, so I get to do what my core jobs are, not, I mean, yes, we know that there are robotics technology, that all is understood, but he's saying, but I don't want my AI to write to me the radiation notes, when I know I need to write down, and I love to write down. So I'm like, I mean, there are two aspects to it, and I feel, as I said, we have to best understand how we want to, as an individual or as a person in any profession, to use these tools to the best and the maximum of its capacity. Yeah.
Yeah, yeah, I think you're right. There has to be a boundary to how tech can be directly
Yes.
applied to healthcare, because
Yes.
it's a holistic healthcare system when we look at a
Yeah.
patient in so many aspects, and just looking at technology, which is again, we talk of ChatGPT getting hallucinated and not understanding, so it doesn't understand all aspects of the systems.
And I'm like, maybe ChatGPT will have some, what do you call, some syndrome after some time, thinking that I'm overworked now because I don't.
Yeah, but
But
I
yeah,
think
I mean, the
you like it or you hate it, but you cannot ignore it. I think
yeah,
the mantra.
true.
So things will become more automated. As we see the kind of pace at which the industry is working. There will
Yes,
be possibly more interventions in giving humanized care, so that the first
yes,
level of care, education, literacy, for example, could be done in a more technology oriented way, and then then the
yes,
human being comes in, where he or she really adds the value in complex
yes,
matters, and the easier
true.
baseline work is done by tech.
And I think it has to be simultaneously introduced, with the digital medium. You need to have the humanized touch, as I said, and it cannot go separately together. It has to be hand in hand. It has to be in a more cohesive way, is what I look forward to.
True. So what advice would you offer to individuals today, given so much of AI and tech is also coming into the play, who are interested in pursuing a career, especially working with patients, patient advocacy within the healthcare sector? What skills do you suggest them to build in them, and how should they also look at tech?
Yeah. So I know the younger generation who is totally tech savvy, with their Androids or with their iPhones that they have, they know everything. I mean, I have a 17-year-old in my house who teaches me most of the things and tells me what to do. So I think, they know what they are doing. But also at the same time, I think they also have to understand that when they come to a patient organization, I'm talking from a patient organization perspective, if they're looking for a career in patient organization, passion is one thing that they need totally. And it is never going to be a 9 to 5 job. Okay, so your working hours are 9 to 5, but they need to understand that it might go beyond 9 to 5 too, because it's not something that you do. You check in at 9 o'clock and you leave at 5 o'clock. There will be a patient call which may come even at 10 o'clock in the night. So it all depends on how you handle these things. Also, certain times, there are activities or events that happen on Sundays or holidays, because that's when the patients are free. Because Monday to Friday they are totally busy with the hospitals and their whole routine in the hospital. So when we have to do, as an organization, we want to do something for our patients, or programs, or mindfulness, whatever you call it, we do it on a weekend, because that's when they are free. They are little less bothered about their hospital queues or anything like that. So anybody, it's a wonderful opportunity. There is a dearth of learning. I mean, I think even after so many years being in this sector, I still learn something new. Okay, a few years back Canva came in. So Canva was something, okay, now everybody was like, okay, Canva oriented. So yes, something that happened from the regular presentations to the Canva presentations, but there are so many other mediums, and you learn so much, whether it is photography, whether it is recordings, whatever. But yes, one thing is for sure, that you don't wear one hat in a patient organization, when you take up as a profession, you wear multiple hats at the same time sometimes. So I think one has to be open, one has to learn a lot of things, because there are a lot of emotions involved here. I mean, yes, hospitals are a different setup, but when you work in the patient care or a patient advocacy forum, the emotions are totally different. So it's not a very, like, you can, it's not a cut and dry thing. It's very, you have to learn a lot on the job. That's what I would say.
So thank you so much, Jyoti, today for joining us on this episode of the Pharma Marketing Playbook. Your journey, your dedication, and insights into patient care and the passion by which you have been inspiring so many of us is certainly, very touching. We are certain that our listeners are also walking away today with much deeper appreciation for the human side of healthcare and the power of purpose-driven leadership. To our listeners, we hope you found this episode of Pharma Marketing Playbook as insightful as we did, gaining new perspectives on patient first care and evolving rate of advocacy in pharma and healthcare. Please also do reach out to us in case you wish to collaborate with the WeCare Foundation and in any way engage and help them out in their mission. So until next time, this is Soumya signing off. Stay curious, stay inspired, and keep learning. Keep pushing the boundaries of what's possible in farm marketing. Thank you once again, Jyoti, for your
Thank
invaluable
you.
time.
Thank you so much, Soumya. Thank you so much. Yeah, thank you.
Thank you for joining us in this episode. We hope that the deep insights and knowledge shared today will help your business and brand grow by leaps and bounds. Remember to follow the podcast. And if you wish to know more about Multiplier AI solutions, please visit the links given in show notes.